So you day-to-day do telemental health. Could you tell us some of the sites you're linking to from White River Junction?
Surely, we are linked to Brattleboro, St. Johnsbury, Littleton, Newport, and Berlin, amongst other sites, and we hope to keep expanding to that. We're about to get another telemental health clinician who will hopefully expand out of Rutland to Keene in the areas down south. So we are covering the state right now with our telemental
Covering
health.
the state of Vermont and New Hampshire as well.
And some of New Hampshire, exactly, and some of New Hampshire as well.
A question that was asked down here was, how do patients like telehealth? Perhaps you can give us some indications of just typically how patients are finding the convenience of telehealth and access as opposed to coming to clinic.
They very, very much appreciate the convenience. There's no doubt about that, and it certainly seems to make it easier for them to adhere to appointment schedules, especially because we try very much to accommodate their schedules around the tele, and the tele makes it easier for us to do that. In other words, a working veteran might not be able to take 3 hours off to drive to White River to get an appointment, but might be able to take off 45 minutes at the end of the day to have a therapy appointment, and we can accommodate that by a tele. So it seems to help with adherence to treatment, and many veterans really quite like the convenience. There is an initial sort of adjustment as people adjust from face-to-face to the tele, but we really emphasize strong alliances. Often we meet the patients face-to-face initially and then build from that to the tele relationship on an ongoing basis.
Dr. Petzel made a point early, which I hadn't thought about, and that is, in an urban area at least, but not so different in a rural area. People have to travel long distances. They get out of the car, they're nervous, they're tired, and then they're asked to start talking about some of the most significant things in their life. I mean, is there some advantage about being 5 minutes away and being in a comfortable surrounding and the ability to really get into your problems? Does it become somewhat advantageous?
I think so, and I think that a skilled therapist or clinician would acknowledge that there's in some ways a difference between the face-to-face encounter and the tele-encounter, that both actually have some advantages in their own way. Often people in the tele-encounter seem to feel more private in a way and are somewhat more willing to discuss some things that might be more difficult if they were in face-to-face encounter. And so that can actually be an advantage in terms of therapy. This is particularly true with younger veterans who I think are more accustomed to maybe interacting remotely, and so maybe feel a little bit more comfortable than they might in the face-to-face encounter about delicate subjects. Safety is always a concern, so we also are very attentive to safety plans that exist at all the sites where we do this, so that veterans who do end up in some distress have a human being there who they can interact with if they need to.
And presumably also one of the things is that you can, because it's more convenient to get access, you can sometimes intervene earlier, so prevent somebody going into crisis.
Yes, absolutely, that is true. And the sites are very cooperative with us about getting us some time if we need it with a patient who might benefit from a small intervention now rather than a hospitalization or some other larger intervention later. All of this is designed, of course, to help keep veterans active in their community, where they live, where they work, with their families, and the tele is very important for that. As I said, just the fact that you don't have to devote half a day to one appointment is critically important for veterans.
I would say we tend to see an explosion. I mean, this is the wave of the future, as I mentioned earlier. This is the way medicine is going to be delivered. I personally think that most consultations are going to begin this way. You'll be sitting in a primary care doctor's office. You'll decide you need to see a specialist, or she will decide. Turn on the video camera, dial up the specialist, introduce the patient to the specialist right then, and that consultation will begin. And it's going to be done that way, whether they're 200 miles away or 2 floors away. This is definitely going to be the way we do business. And one of the major issues is changing our clinical work processes to accommodate to the change in the way we do our business.
And I suspect this is probably cost-effective as well, is it not?
Yes, it is.
And after the initial investment.
It can eventually, when people are skilled at it, it is a more efficient use of the specialist's time, as was mentioned. Patient adherence to therapy is much better, whether it's mental health or something else. We don't have to have the substitutes for clinic visits, which are expensive to do, and there's of course the expensive traveling, et cetera. So yes, in the long term, this is a cost-effective way to deliver care.